Welcome to This Explainer. Let's dive right in, shall we? If you're prepping for the MRCPCH clinical exam, you already know the deal. That developmental history station, yeah, it can absolutely feel like a high-pressure race against the clock. But today, we're going to take all that pressure and transform it into a perfectly structured, totally manageable checklist. We're going to break down the exact sequence of questions you need to ask to get a full developmental history from the patient's mom, extract every single piece of necessary clinical data, and confidently impress your examiner.
12. That's the massive number of marks this single station is worth in your clinical exam. Getting all 12 of these requires a flawless first 10 minutes of history taking. I mean, if you nailed this developmental history, you're setting the trajectory for the entire scenario and accurately diagnosing the case. So the bottom line is, you literally cannot afford to wing this. You need a system.
So here's our game plan for the station. Setup and concern, present history and causes, critical medical background, social history and impact, and finally, the final clinical presentation.
Okay, let's kick things off with Section 1, the exam setup and concern.
Before you even think about firing off medical questions, you've got to anchor yourself. The very first thing you should do on your notes is just draw a simple grid. In this grid, immediately write down the mother's name, the child's name, and the child's age. This really simple act just kind of organizes your mind. Then, you look right at the mother and ask for her main concern. What brings her in today? This establishes instant rapport and hands you the primary thread you're going to pull for the rest of the station.
Now, there is an absolutely critical distinction to make right here. Once she gives you her concern, you must ask about the child's skills. Specifically, you're hunting for the difference between a simple developmental delay and a much more dangerous developmental regression. You have to ask, has your child lost any skills they previously had? Identifying a loss of milestones completely changes your clinical pathway.
Moving right along to Section 2, present history and causes. As you're gathering the details of the mother's complaint, you need to systematically rule out severe triggers. You've got to ask this exact question. Do you have any concerns about trauma before? Alongside this, you also need to explicitly ask about any history of severe fever or infections. These are vital questions to hunt down the root cause of neurological issues. We're basically acting as clinical detectives here, ruling out acute external causes for the child's developmental state. Oh, and you also want to ask about daily routines at this stage. It's a fantastic, subtle way to screen for autism patterns.
So while you're asking all these questions, you're also carefully observing the child. If you spot phenotypic clues, visual signs of a specific condition, you must pivot and ask highly targeted questions. Like, if the child has features of Down syndrome, immediately ask about heart conditions. If you suspect Duchenne muscular dystrophy because of motor weakness or delayed walking, target that. Or, if your clinical intuition points to Rett syndrome, you've got to ask about abnormal breathing or arrhythmias. Customizing your history based on visual cues shows the examiner you are really thinking on your feet.
All right, on to Section 3, critical medical background. This right here is your mandatory timeline. You absolutely must ask about the pregnancy, the birth, and the immediate postnatal period. Was there a NICU admission? But here's a little pro tip for you. While you're exploring this timeline, explicitly ask about skin discoloration or birthmarks. Why? Because a specific birthmark could be the key to diagnosing neurofibromatosis or Sturge-Weber syndrome. It's such a simple question, but it yields massive diagnostic value.
Continuing that deep dive, you have your past history must-asks. Have they had recurrent UTIs, any previous hospital admissions? And critically, you need to check the growth chart. Is the child suffering from wasting, obesity, or short stature? If you spot any anomalies on that growth chart, your immediate follow-up must be a question about their nutrition.
Okay, pay attention because there is a massive clinical red flag here. You must ask about vaccinations. Never, ever skip the vaccination history, especially, and I repeat, especially, if you identify developmental regression earlier. If a child was normal and then regressed, it could totally be a post-infection complication. Take subacute sclerosing panencephalitis, or SSP, for example, which can happen after a measles infection in an unvaccinated child. Checking vaccine status in regression cases is absolutely non-negotiable.
Now, what if during all this, the mother mentions the child has seizures or fits? You immediately deploy this vital mini package of questions. You don't just note it and move on. No way. You ask, are the seizures controlled? When was the last hospital admission for them? What medications are they on? And what is the family's emergency management plan? If seizures are anywhere in the history, this full package of analysis is required.
Let's pivot to Section 4, social history and impact.
I want you to pay close attention to this number, 4.
During your exam, a bell will ring when you have exactly 4 minutes left. When you hear that bell, you must drop whatever medical question you're asking and pivot immediately to the social history. Seriously, do not wait. Finish your sentence and just move on. The developmental station is notoriously packed with positive data in the social history, and examiners are literally just waiting to give you marks for uncovering it.
Here is your high-yield social history checklist. You need to ask about family history and consanguinity. Basically, are the parents related? You must respectfully ask about the home situation, income, and insurance, because this dictates the reality of the child's ongoing care. Ask who the primary caregiver is. Ask about the siblings. And check on their school or daycare situation. This whole shebang paints a complete picture of the child's support system.
Right before you finish this section, you must ask this exact question. What is the impact of this condition on the child and the family? This is where you demonstrate deep clinical empathy. You're showing the examiner that you understand this isn't just some clinical checklist. This condition places a real, heavy burden on a family's daily life. It is an incredibly important moment in the station.
And that brings us to Section 5, the final clinical presentation.
Okay, here's a highly practical tip for organizing your thoughts when you're under pressure. Remember that piece of paper where you drew the grid? Use the blank white space in the margins to quickly jot down your problem list. Crucially, visually separate the medical problems from the non-medical or social problems. Keep your eyes only on this clean white space so you aren't getting distracted by your earlier, messier notes. This sets you up perfectly to deliver a crisp, confident 1-minute summary to the examiner.
And here is the exact foolproof script for that summary. You open by stating the child's chronological age and the mother's main concern. Then, clearly state whether the issue is a global developmental delay or an isolated one, like, just motor or speech. Finally, conclude by definitively stating whether this is a case of simple delay or if it is developmental regression. Deliver this cleanly, and you have perfectly set the stage for the 6-minute physical assessment phase that follows.
So, what does this all mean for you? Are you ready to execute this perfect 10-minute checklist and secure your 12 marks? By structuring your approach, staying incredibly disciplined with that 4-minute warning, and using these precise scripts, you transform a daunting station into a showcase of your clinical competence. Take this framework, practice the flow, and go own that OSCE. Thanks for joining me on this explainer, and happy studying.